Hi, guys. Welcome to Farmer Fridays, where I get to interview agriculturists, ag organizations, and ag businesses across the state of West Virginia. My name is Elizabeth Lynch, Miss West Virginia 2022. I am extremely excited about today's interview. We have Dr. Carol Greco, who is in charge of the FARMacy program in West Virginia. I've actually wanted to talk about this program for so long now, and I am finally getting that opportunity. So thank you so much for being on today's interview.
Thanks, Elizabeth. I appreciate the opportunity to talk about the program.
Of course. So let's go ahead and get started. So tell me a little bit about yourself, and then if you have any agricultural background.
So I am a family physician by training. I've been in practice in the Upper Ohio Valley area, specifically Wheeling, West Virginia, for over 35 years as a family doctor. I have no particular experience with agriculture other than being a backyard gardener, but have learned quite a bit through this program and through the West Virginia Department of Agriculture over the last 5 years or so.
That's phenomenal. So go ahead and tell me about the FARMacy program in West Virginia. How did it get started?
So FARMacy West Virginia got started back in 2016. So we've been up and running for about 7 years now. Again, we started in Wheeling, West Virginia, at Health Right Clinic, which is a free and charitable clinic here in the community. We meaning my partner and founder of the program, Amanda Cummins, who is a PA that's worked with me for quite a while, realized that the patients that we were coming in contact with were showed signs of lots of chronic disease, specifically related to their diet. And we realized really very quickly after doing diabetic group visits that patients just didn't have access to fresh, locally grown produce and didn't know how to prepare it, and really didn't know why it was important to eat healthy. So we developed this program in conjunction with Greco-Ohio Valley, which is our local urban farming group here in Wheeling. And what we did is we selected 35 patients in 2016 to participate in this program. And we gave them 16 weeks worth of produce through the West Virginia growing season. So that was about $15 to $20 worth of produce a week for 16 weeks. During that time period, we provided them with basic education through the West Virginia Extension Office on both nutrition, why it's important to eat healthy, how it affects your overall health, and also cooking skills. So again, patients were very unfamiliar with how to prepare certain items of produce, things that were not common to them. For instance, eggplant, butternut squash, things like that were quite foreign to some people. So they were provided with that education. And in order to show the patients as well as to prepare for sustainability of this program, we did lab work pre and post program. So we looked at their diabetic levels or their hemoglobin A1Cs and their cholesterol levels before the program started, and then again at that 16-week point to see if there was an improvement. We also took their weights, we did their blood pressures, and we also had them fill out surveys, which were very important because we looked at things like a patient's diet. Did they eat pre-prepared foods? Did they eat fast foods? What was their food security issues? Were there any food insecurity issues in the home? And basically what kind of knowledge they had on the preparation of fresh produce. And we looked at that before the program and again after the program to see if there was any improvement. So that's the program in a nutshell, and that's what we have expanded on throughout the state since 2016.
And you guys have expanded largely, correct? If I remember correctly, it's about 25 counties in the state of West Virginia.
Yeah, so technically now, again, we have 4 pillars that I'll explain later on, but with the programs that we have actually helped to establish and which provide the 4 pillars of the program, it's about 23 counties, and we have 26 to 27 sites now in those 23 counties. So yeah, we've expanded tremendously in the last 7 years.
That is phenomenal. So, what is your main mission? What is the FARMacy West Virginia main mission?
So our mission statement says providing access to fresh, locally grown produce, as well as education and cooking skills to patients with chronic disease. That's our mission. And we certainly have a huge mission to accomplish in this state, since we are the worst, and literally the worst state in the country as far as incidence of type 2 diabetes, obesity, high blood pressure, and heart disease. So we have a tremendous goal to accomplish in the state.
And like you've said, this is so much more than providing those healthy, fresher options. You're also providing cooking classes, and you've got recipes and educational programs. So people have the ability to learn so much by being a part of this program. So what's going on with it today?
So today, actually, we are just wrapping up the growing season for 2022. We had actually 8 clinics that we were sponsoring with funding this year with our DHHR grant. And these clinics have all wrapped up for the season. And we're actually now starting to plan for 2023. We have functioned mainly from our aspect on grant funding. We've gotten several very large grants through the Walmart Foundation, through the DHHR grants. We have started to work with Unicare here in the state to help support some of their patients, and they have given us some funding to do that next year. So we are, gradually expanding. Again, money is always the problem, and that's what we're working on to actually accomplish sustainability of this program.
And now, what are the benefits as for you as a person if you became a part of this program? What are the benefits? I know you mentioned that you did testing before and testing after. What have you seen?
So we have seen great results. The first couple years, when we were just starting out and just, learning how to tread water a little bit with this program, we saw a reduction in the hemoglobin A1C of about 0.4 to 0.5. And for those non-medical people on the program, that's significant, because most diabetic drugs, or drugs that lower blood sugars in diabetic patients, really can't say that much. They can maybe say 0.5, but that's medication, right? We're promoting the idea of food as medicine. And so we think that our program, being a lot safer, no side effects, a lot healthier for a person, does just as well as diabetic drugs. And again, you have to remember, this is just a really short period of time. Our growing season in West Virginia really doesn't go over 16 to 18 weeks. So that's a big drop in a short period of time. And again, one of our goals is to be able to continue on with that so that we can help people access fresh foods, or even fresh frozen foods, throughout the winter months. So again, that's something else we're working on. But our results were dramatic as of, 2019 through COVID 2020. We still continued on with the program, and we saw a drop of 0.9 in the hemoglobin A1C, which is amazing. It's amazing, right? It amazed me. I was like, wow, this really worked. And then we saw lowering of cholesterol levels by about 8 to 10 points, total cholesterol levels. Doesn't sound like a lot, but it's only 16 weeks. So what would happen if we can continue 365 days, and what would we see with that? And again, we're not doing anything other than putting fresh vegetables, fresh produce into a patient's home and teaching them why it's important to eat it. That's all we're doing.
That is phenomenal to hear. I'm getting goosebumps listening to you speak about this. Now, the other thing too is, even though it's 16 weeks, you're still giving people the tools and the resources necessary to continue eating healthier throughout the rest of the year if they would choose to, correct?
That's right. That's where the educational component comes in, right? It really drives home the fact that eating healthy empowers you to control your chronic disease. And we have 53, our mortality rate is 53% higher for diabetes in this state than any other state in the country. And that's that's ridiculous. I mean, that's just, it's amazing, blows me away. And I was amazed when I saw that statistic. But I do know that at least half of the patients or half of the population in the state of West Virginia has high blood pressure. So that also is, you know, that's crazy. And we need to do
Scary
something.
statistic.
Yeah, that is something that we're, trying to curtail and trying to help patients to be able to understand why it's important to eat healthy.
Right. And these educational programs, you also are partnered with WVU Extension. I remember you mentioned that before, correct?
Right. We are relying as solely with the programs that we are funding specifically with WVU Extension Office. They provide a 6-week program. It's called through the Family Nutrition Office there, or program there. And again, it's basic cooking skills. And it's a hands-on program with regard to that part of it, and basic nutrition education. That's, in addition to the produce pickup. But we also have extension officers that are present during the produce pickup that are actually supplying recipes to the patients, discussing, something that they've pre-prepared, So we have a lot of green beans. We prepare a green bean salad and we, let patients taste it and, teach them how it's prepared and why it's important to include that in their diet. So there's a one-on-one relationship that develops with the patients and the educators, both on site during the produce pickup and then again through the educational component later on.
Phenomenal. Phenomenal. Now, if I wanted to become a part of this program, how do I make that happen?
So again, we're not in every county,
Right.
but we really do want to expand this program. I mean, that's our goal, to have every patient in West Virginia who wants to participate be able to participate. So if it does not exist in your county, and again, how would you find that out? You would check with your local clinic, your provider at the local clinic, to see if they are participating. If they are not, you can inform them of the program. And I do have a website that you can contact me directly. And we would be happy to get in touch with the clinic and also, discuss with them how to set up the program. That's what we do. We coordinate the program for any clinic that is interested in providing the services.
Phenomenal. Absolutely phenomenal. And then so say you do have it in that specific clinic, you walk in, do you have to get a prescription to become a part of this program?
Yeah, so one of our pillars that I mentioned before is a strong patient-provider relationship. And the provider, be he or she a actual doctor, physician, or nurse practitioner, physician's assistant, does provide the prescription for the patient. And again, that kind of drives home the concept of food as medicine. Back in the old days, before e-scripts, patients did get paper prescriptions that they took to the pharmacy and they exchanged it for their medication. And that's the same idea with this program. Patients take their prescription, hand it to the farmer or grower who's present during the pickup, and exchange that for their produce. And during that exchange, again, the exchange is set up like a farmer's market style, so that the patient can actually handle the actual vegetables. There's an educational component that goes on during that process also with the farmer and grower, who can help to educate the patient on, again, some of the nutrition, but also how the produce is grown and what that all entails. So there's a bunch of education that goes on during that 20-minute produce pickup, and again, driving home the idea that healthy food is medicine.
Absolutely. Is there an age limit to this? Can children also get this prescription?
So we have not dealt with children below 18 for this.
Okay.
That we have dealt with basically patients who have chronic disease. So again, diabetes, type 2 diabetes, high blood pressure, heart disease, obesity. But there are programs in the state that have functioned for children. There are,
Okay.
Yeah.
That's really neat. I mean, again, I'm very excited about listening to this program and listening to the details. Are there online resources available as well for somebody who might not want to go to the doctor for this?
My website, it's FARMacyWV.com. I'll refer you to that first. But I think for actual, if anyone is interested in getting involved in the program, they can contact me directly. I can refer them to any clinic that is available in their county. And if not, we can start a new program. I mean, that's what we're here to do. We're here to
Right.
coordinate programs. I'd like to have it all 55 counties in the state if we could. So yeah, just contact me and then we can work it out with any questions.
Yeah, that'd be great. And what I'm going to have is that link actually posted in this interview so that you're able to just to click on it and follow it through. I did want to ask too, this program has helped so many West Virginians. How has it impacted West Virginia agriculture?
So we don't have statistics on that yet,
Okay.
but I can't help but think that it's impacted it positively in that we rely on our farmers for the produce. We rely on the farmers being able to supply produce for 15, 16, some programs up to 20 weeks for this, and they are paid up front. So
Wow.
they're guaranteed a set price. Again, it's $20. We may need to increase that next year to $25 per patient per week, and again for 16 to 20 weeks. So it does positively impact the farmers. It does require some education because a lot of farmers are not used to growing that quantity of food consistently for that period of time. And maybe not the variety of produce that we have asked for this program. So we partnered with the Department of Agriculture in West Virginia, I want to say 2018, and they have helped us to educate the farmers with regard to production planning and how to expand the variety of foods that they're growing. So that has been a great partnership.
That's phenomenal. I love this. So it's positive in both directions. Producer and consumer, bridging that gap and making sure that both are benefiting from that. That's excellent. Now, how can we make sure that FARMacy West Virginia becomes a long-term sustainable program? You guys have been around since 2016. How can we make sure that that happens forever?
Yeah, and so like I said before, we have been relying solely on grant funding and gifts and local philanthropists to provide this program in different communities. We've also relied on community benefits money from hospitals and clinics and that kind of thing. But that's piecemeal money, and that's not guaranteed every year. So we need to make this program sustainable by getting it paid for through Medicaid, managed Medicaid organizations such as Unicare are on board with this program at this point, and Medicare for older people, right? And then the local or the private insurers could also pay for this. And this is not a new idea. I didn't come up with this. There are Medicaid waivers included in Medicaid funding, which allow for this program if it is allocated by that particular insurer. So it is there. It needs to be allocated to this program, and that's where obviously our difficulties lie. So having the support of legislators, having the support of our governor would be a wonderful thing to help this program. I mean, it's a win-win-win. You just said it. The patients win, and the agriculture society wins. It is truly benefits the economy of the state. So.
Now, can our agricultural sector also promote the sustainability of this program too?
Yeah, so if we do what we want to do, which is to increase this program, increase the availability of this program to anybody who wants to participate, we need more farmers, and we need farmers to grow more food. If we don't have that, then we don't have the program. And I would hate to have to go to other states. I could go to Ohio and Kentucky and beg for food there, but I don't want to do that. I want to support the state of West Virginia. I want to support their economy. I want to support their farmers. And this program is just perfect to do it. So we need the help of farmers. And the farmers that we've actually, interacted with over the years are really supportive of this program.
Right.
Not just because they're, making money off, from this program. It's because they realize that their part in this is really important to the health of West Virginia,
Absolutely.
right? So it's vital to this program to have farmers participate and be able to, grow the needed produce.
And something that I try to do is convince people to join the agricultural industry, whether that's through farming or through some sort of agricultural career, and make sure that we can secure the future of agriculture. So, with that being said, why do you believe in the future of agriculture?
I think we need the future of agriculture really in the state. I mean, like I just said, if we don't have farmers, we don't have this program. If we don't have this program, we certainly aren't going to be able to deal with the poor health problems that we have in our state. Our group, our team, FARMacy West Virginia team, believes that this program in part will help to improve the health of all West Virginians. It's not brain surgery, it's not rocket science, it's not anything like that. It's basic education, it's basic access to food, because as you know, as well as I do, we have a lot of food deserts in our state. We have a lot of food insecurity that exists in our state. And we need to be able to have patients readily access healthy food.
Absolutely. Is there anything else before we close out today that you would like to add?
I just want to say thank you to you. I think it's wonderful that you reached out to me to have me, be able to inform people of this program. I think the more publicity we get on it, the more likely we are going to succeed and be able to accomplish our goals. So just want to say thank you to you. And if you have any influence with legislators and the governor,
Yep, we will definitely get to that after this interview. I definitely want to talk to you about this. But thank you so much for agreeing to speak with me today. I have been a huge fan of this program from afar for so long, and I'm so glad that I'm able to share all of this information with my viewers at home. And if somebody wants to contact you for questions, just again, they go through your website, correct?
correct. My information is at the very end of the website. It says contact, so that's how you get to me. Just email me. I'm happy to, answer any questions and connect anybody to programs that already exist.
All right, guys, you heard it here. Make sure that you're asking those questions, get more involved, try to help out with the FARMacy program, because obviously it's doing something phenomenal for the people of West Virginia. As you heard, food is medicine. Make sure that you take that advice in. All right, guys, that is the end of our Farmer Friday interview for today. Please make sure that you are always thanking your farmer, and tune in next week to see who I get to interview next. Thank you.